Good morning, everyone. I want to welcome you to the Atlantic Council. I'm Damon Wilson, Executive Vice President here. I'm delighted to have you with us for what I think is going to be a very important conversation, a series of public conversations today, which we've called Peering Around the Corner, the Geopolitics of the Coronavirus. At the Atlantic Council, we're committed to U.S. engagement in the world with our friends, our partners, our allies, and tackling global problems, solving global problems. And I think what we're seeing unfold before our eyes right now is a challenge of global proportion that commands our attention. With the Chinese government's official death toll now surpassing that of the 2002-2003 SARS outbreak, the 2019 novel coronavirus presents a global crisis with mounting public health, geopolitical, and economic repercussions. We want to unpack these today in this conversation. I'm going to encourage everyone who's following this online to join the conversation on social media using the hashtag ACChina, hashtag coronavirus, and to send in your comments, your questions throughout the conversation. As efforts are continuing right now to contain this outbreak, we're already seeing how geopolitical considerations have limited the effectiveness of coordinated response. Particularly as concerns over the trustworthiness of information have made the precise scope and severity of the crisis unclear, one of the particular issues we're going to unpack in our panel conversation today. Likewise, the economic reverberations of domestic quarantines and international travel restrictions have led some analysts to forecast increasing deceleration of Chinese economic growth and disruption of global supply chains and trade in the weeks and months ahead. At a time of a lot of optimism about the economy, this could be an event that is the most disruptive to global economic growth, the most consequential. So in short, we may be witnessing the start of a potentially historic crisis that will test both the Chinese government and the international community's response as a whole. So here at the Council and our family, we've been working to meet this multidimensional nature of the challenge at hand by bringing together experts across our 12 programs and centers to help provide cutting-edge analysis and understanding the implications of what's happening, to think through actionable policy recommendations for understanding the outbreak, reducing its negative impacts, and expediting its resolution. At these critical moments, we at the Atlantic Council believe it is the imperative that the United States work with its allies and partners around the globe to demonstrate the capacity of the rules-based international order to lead an effective, coordinated response. I think as we have this conversation today on the geopolitical implications of a crisis, we also have to remember that this is a human-centric crisis and that real people are dying, that real people are being impacted, and that it's a incredibly complex, interesting challenge, but with incredibly palpable real-world consequences that demand our attention. I'm really pleased to see within our family at the Council that this is a product of collaboration across our centers, and today it's the Scowcroft Center for Strategy and Security and its Asia Security Initiative, the Digital Forensics Research Lab, and the Adrian Arsh Latin America Center that has a big program focused on China's role across the Pacific that's brought together today's discussion. This first session, and I'm delighted to be able to welcome Tom Bossert back into the Atlantic Council House. We'll tackle the geopolitical implications of the outbreak. Our second session will drill down into the issue of information, disinformation, misinformation surrounding the crisis. I'll leave it to our moderators to introduce each session's speakers and to outline the focus, but I want to start by thanking all of them for joining us today, for giving us their valuable time, their insights. We're looking forward to the conversation. So as a reminder, we're on the record. We're being live streamed with a larger online audience, and I want to, with that, turn over the stage. I'd like to invite former U.S. Homeland Security Advisor, a close friend and colleague of the Council, Mr. Tom Bossert, along with Atlantic Council Senior Vice President and Director of the Scowcroft Center, Barry Pavel, to the stage to kick off today's discussions. Thank you, gentlemen.
I'm Barry Pavel, the director of the Scowcroft Center. Thanks, Damon. I do think it's important to, keep in mind the human, the real human ongoing costs of this virus, even as we're addressing the, dispassionately, somewhat the broader geopolitical questions. And I'm really honored to be sitting here with my great colleague, former U.S. Homeland Security Advisor to President Trump, Tom Bossert. He also has many other hats: national security analyst on ABC News, Chief Strategy Officer of Trinity Cyber, and the most important thing on his resume by far in his entire career is he's a distinguished fellow of the Scowcroft Center.
That's right.
I was just kidding there, Tom. Certainly when he was Homeland Security Advisor, Tom was the nation's chief risk officer and senior advisor on a broad range of domestic and transnational threats, cybersecurity, counterterrorism, homeland security, and then today's discussion, global health security policy. And so we're delighted and lucky to have him here. Just wanted to take a minute and frame this a little bit. In the Scowcroft Center, we try to take the broad view and the long view. And so we look back at history and we try to project forward using scenario-based planning and other approaches. And someone told me last week that except for climate change, there are 3 potential existential threats to humanity on Earth. One of them is nuclear war. One of them is a potential large asteroid hitting the planet. And the third one is the threat of a global pandemic. And unfortunately, it's the third threat that's the most likely and seems to be often threatening to recur. Since we're discussing the geopolitics of the novel coronavirus, it's worth taking a look back in history. And when you look back in history, some of the major global pandemics have changed geopolitics, have changed the balance of power in the world. Some states have declined precipitously. For example, when the Black Death came out in the late 1300s, about a third of the global population at the time was killed by that pandemic. Regarding this year's pandemic, some measures that are being taken, for example, the Chinese government this week workers seem to be returning to work a bit, just starting this week. This sort of suggests that the virus may have peaked, and we'll get into the information questions on the second panel. But other measures that I see on a daily basis, such as today the UK announced that they consider the coronavirus, quote, an imminent threat. They're taking significant new measures to try to contain the threat. We saw some new reporting in Hong Kong this morning about concerns about the transmissibility of the virus, and it goes on and on. I did want to show a slide for context from the New York Times, which will point out at least that the coronavirus is dangerous, but not quite as dangerous as Ebola. And so if the danger level is the vertical, and so you see the much more deadly viruses at the top, MERS, Ebola, Spanish flu, smallpox, and then the horizontal axis, and this is a logarithmic scale at the top. The horizontal axis is how quickly it spreads, and so not quite as dangerous as measles or chickenpox in that regard. And I think this box we should take with some degree of uncertainty. This is, best estimate as far as we know it. But I do want to place, all the headlines in context in terms of how we see it today. But the numbers are grim and they're growing, unfortunately. Over 40,000 cases reported. Emphasis on that word so far, and over 1,100 deaths again so far. And so with that framing, a few facts and analysis to kick us off, I wanted to turn to Tom. Sort of maybe start with the bigger questions. I mean, how worried should we be about this? What do we know, and what do we don't know?
It's always about humans first, right? So stop the dying before you stop the suffering, that type of analysis. But this box, it dawns on me, Barry, ranges from the seasonal influenza virus in its fatality to almost the 1917 or 1918 Spanish flu. So the uncertainty in that box is terrifying. And the answer to your question, all of your questions today, I suspect, will be we don't know yet. And that's frustrating, and there's a number of reasons and causes. There are people to blame always. But I'm not so much focused on that. So for me, my biggest concern with all those caveats is trust. Public trust is public health security. Public trust right now is a national security matter. And if we can't maintain it, find some sources of information that people can depend on, tell the truth. I think so far we're doing pretty well at that. And then tell what we don't know. So far we're doing pretty well at that. and then maintain throughout a dispassionate ability to deliver those facts on what we do and don't know, then the outcome of this could vary from good to bad to complete chaos. And so maintaining public trust is my biggest concern today. And that is because I have studied and looked at all the actions being taken by all the various governments involved in this and all the individual public health actors. And they all seem to be, despite some tremendously difficult fits and starts out of China, doing the right thing. I would give China another bad grade on this, but I don't think it's really necessary to start issuing grades right now. Let's go back and do that after the fact. They're cooperating more. It seems like they're becoming more and more transparent. They're also more and more dependent upon outside aid, so there might be a correlation between their willingness to share and the predicament that they find themselves in. And so I'll try to focus most of my comments on what we do next. And I think maybe my advice to leaders here, so far the administration's doing a nice job of this, and I want to commend Dr. Redfield and others at the CDC. But pretty soon, if this ends up in the United States and in Western Europe in places that it's not yet, really, we're going to end up turning to authorities that we've never heard of or seen on national television. It's going to be a local and a state issue. There's going to be doctors and hospitals involved in this that are not necessarily considered public leaders on a regular basis. And we're going to have to find trust in them. And the idea here that I always give to leaders is to be clear and consistent with your facts, but then try to the best of your ability to forecast. So message forecasting is important. Most human beings feel terrified. On my way here today, I took an Uber, and the Uber driver asked me 100 questions about coronavirus. It prepared me for this morning. And it to me, every one of his questions centered on, I don't know what's next. And so being able to predict the future is usually a good trait in a leader. I'll tell you where we are right now. President Trump has attempted message forecasting, and he has said this might be over by the end of April. And I hope he's right. And I know he's getting good advice on that because it also might not. And so while he's trying to project the right future forecasting and messaging there, and it's a difficult game, he's got to get into that game. It's a hard job. The rest of us are trying to figure out how to prepare for the what if that's not the case. And so the downside risk management and risk planning is consuming the community right now in the world. And the geopolitical analysis we can get into now, but that comes second. And so far, I think everybody's maintained that view.
I see. I saw some concerning reporting last week on sort of how Wuhan is being dealt with. I mean, the suggestion, which I think might have been a little sort of dramatic, overly dramatic, was sort of China's completely sealing up Wuhan to save the rest of China. But there were 5,000 people or so that have left Wuhan since the outbreak and have now spread to other cities. So how do you think, is there a situation, how do you think that's being handled? Or how would the U.S. handle it? I mean, I can't imagine a city the size of Chicago being quarantined. So what's your sense of how it's going, in China, which is important to the global, continues to be important to the global potential spread?
Yeah, well, I could talk about this all day. In the United States, let me go back into that. In the United States, we have different authorities, and obviously federalism is a difficulty in the United States. And I say that jokingly. It's a good foundation on which to build a government. But in times of crisis, we usually crave centrality and leadership. In the United States, we have two different authorities. So if it should manifest into a larger outbreak in the United States, we have an internal quarantine authority that resides with state officials and local officials. And then we have a travel or a border quarantine authority that resides in the Commerce Clauses of the United States Constitution. And it's been turned into law on the Public Health Act. And so the President and the State Department have been using that border quarantine authority to stop people at ports of entry, apply what's right now an unreliable but nevertheless prudent test to travelers, and to do what we can to prevent its spread. But let me answer the question about China. There is in this field what they call a quarantine dilemma, and there's no real way to fix it. The quarantine dilemma, on one hand, says if you act very quickly and prudently and efficiently with brutal decisiveness, then you'll be so effective that the public loses faith in you because they think you've way overreacted to a problem that doesn't really exist and there wasn't that much of a disease and you guys all inconvenienced us for no reason. On the other hand, if you wait too long, people certainly realize the importance and they understand the severity of the problem, but you've waited too long to contain it. So you suffer less political blowback in an American analysis. That's how I look at it. In China, there's a kind of more subtle face-saving mentality. I think the Chinese government always places as paramount importance, places as the most important kind of quality stability in their populace. And so as a result, they debated and deliberated and held on decisions and held on shared information, and they went too late. And so now the geopolitical observation, 1917, before the 1918 flu, was World War I. It was a great mixing of human beings all over the world in small confined places and airplanes and ships and drinking from canteens and all that. This one had a number of different kind of confluences of geopolitics, if you will. Just in that period between December, when the novel disease broke out, January 10th, when it was identified as a novel coronavirus, and then some days later, 12 days later or so, when they put travel restrictions in place, the Chinese New Year happened. And so think of it being Thanksgiving here. It wasn't just people from Wuhan and the Hubei province traveling to see their families. It was all of their families also traveling to places where they could congregate and be together, and then they all returned. So what we don't know is whether Wuhan will be the patient zero, city zero epicenter of this, or whether it's just the first of dozens of cities in China that will go through a curve of this nature. And that's what we're waiting on for the next few weeks, to see if there's another Wuhan or Wuhans. So World War I was the mixing. In this case, the Chinese New Year was the grand mixing. Add to that the fact that Taiwan was always our interlocutor for public health sharing of strains of virus and public health information. The Chinese don't traditionally share this information with Western authorities. Often we've in the past constructed backdoor ways of communicating through Taiwan to Western authorities. It's my sense, I don't have any quantifiable proof on this yet, but it's my sense that the tensions between China and Taiwan this year were so high, Hong Kong and other things, that, and the election cycle going on in Taiwan, that there was absolutely no communication taking place. So as we do an after action on this, I think we're going to find that New Year and the Taiwanese-Chinese tensions ended up exacerbating this.
Sort of like the perfect storm.
Perfect storm. There's always something that makes this disease cycle worse. Yeah. This is it. And then from there, it's an economic analysis. I think Damon hit the nail on the head. Mm-hmm. Australia seems to have the greatest exposure to the Chinese economy. Now maybe us second, but Australia's got 23% of its imports and 36% of its exports, or vice versa, to China and from China. Half of their natural gas market is Chinese consumption. I think the concern now is the Chinese as a whole are going to reduce their commodities requirements. And so I think Damon hit this right on the head. This is either going to get worse, and there's going to be multiple cities, and the Chinese will have failed to contain this. And the world will suffer the supply chain ramifications and the economic growth reductions. And you're seeing those across the board. We'll talk about them next. I think the established, respectable analyst shops suggested that we could go as low as a 5% growth rate in China, which is a reduction, a significant one. I think East Asia has been reduced in its growth anticipation growth rate down to 3%. Those are pretty low numbers. They're downward adjustments. If all of that happens, we're going to almost certainly arrest our boom cycle. If not, trigger us into a temporary recession. That's what economists say, and those are a bunch of ifs. It's important to not cause panic and induce fear and move markets for no reason right now. It's just as plausible that we have a fatality rate that looks more like seasonal influenza. The seasonality of the coronavirus, the novel strain, might also, which is unknown, track with the end of the winter and go down just like seasonal influenza. There's a whole lot of ifs that put this at a more normal blip in the public health radar. So what we don't know is, 2-3 weeks away, they keep saying?
That's what worries me.
Yeah.
Over the last month, the experts that I've spoken to or read about have always said, well, we'll know more in 10 to 14 days. And we're still saying we'll know more in 10 to 14 days. And I understand that, but to me, it would be welcome to see a reduced slope in terms of the key indicators.
One of the things, just to think this through, right? So we've all read about this. So I'm no doctor, so I don't want you to take me as a clinician here, but we're having this kind of dual phenomena of people that are asymptomatic transmitting the disease. So you can show up at the emergency room, feel fine, show up at the airport, feel fine, and test for it and test negatively and go out and spread the disease all along, right? So we've got this asymptomatic transmission of the disease with this long incubation period, this 5 or 6 day incubation period. So we don't know how to model it. But the problem I see right now is that there's a lot of problems, but capacity being one of them. We don't have the test necessary to test somebody after this is over in Wuhan, right? So they do these serum tests where they'll determine whether a person has the proteins and the antibodies in their bloodstream that suggest they had the illness. That's how you, after the fact, determine the actual number. So in preparation for this, I mentioned to the team, and the next panel is going to hit on this, I believe, prevalence is the number you want to look for. We don't know what the prevalence is or was historically in Wuhan. We still don't. The disease could take its full course in this city of 11 million people, and we still don't know what the prevalence of the disease was in that city as separated from other diseases. So the model right now that seems to be gaining traction suggests 5%, meaning 1 out of 20 people contracted this disease. Now, in Wuhan, it seems to be far more fatal. It seems to be a more mild result in Western patients. That hopefully that trend continues. I don't know I don't know to what to attribute that. Pre-existing respiratory conditions, age, those types of things. But if 5% holds and spreads across the globe, the math is staggering. And if you still take a 1% fatality rate and it spreads evenly, although conditions are different, but it spreads relatively evenly into the Western hemisphere, we're going to end up with a pretty significant panic, and public trust will become important, and response and treatment will become important, and diagnostic kits and investment in our public health system at a state and local level, who traditionally have narrow budgets, will become important, and that'll all be done in a hurry, and the time-compressed environment coupled with the fear and panic could have economic consequences that we haven't foreseen. So I'm still fairly confident that what we're doing is right, very confident that what the United States is doing is right, fairly confident that the Chinese are getting their act together. Let me distinguish the two. And then almost completely blind on the other 27 countries that have reported Wuhan cases. So I guess the other 25 countries, 27 total. I don't know their capacity, I don't know their investment levels, and I don't know the conditions in those countries with respect to public trust and disinformation.
So many issues to discuss here. I'll ask a few more questions, and then please would welcome questions from the audience. I think I'll start with an interesting one that's not discussed too much, and that is, when you think of these existential threats, potential existential threats to humanity, is this a moment for the U.S. and China, the two largest powers on Earth, to come together, cooperate, figure out how to contain this virus, but also figure out how to prevent the next pandemic. And I know the U.S. has offered experts, but if you're in a competition with another great power, the accepting experts can be problematic, especially in the Chinese bureaucracy.
Yep.
The way it was described to me during the last epidemic was the Chinese said, here's a military base in China, drop the supplies off, we will transport it to the locations where we need it. So lots of different forms of cooperation. Is this a moment for the two powers to come together and cooperate?
Boy, I hope so. I hope so. I don't know if I have a lot of hope, but I hope so. It's an opportunity. Let me kind of give an outside objective grade on this that I couldn't have said when I was in my former role. I really legitimately think the U.S. has handled this appropriately, and they've, with kind of a soft touch, approached the relationship with the Chinese. There's no need to go out and constantly rail about what we all know, and that their deficiencies are pretty well laid bare for the world to see. So providing over $100 million to the Chinese and surrounding areas, that's a low figure, really. We've provided a lot more. Marshaling not just government resources, but private industry resources. Think about what's happening if you're in Hubei province. I've been getting some, and I'm sure you've seen this, pretty disturbing reports. The clinicians there doctors, nurses, emergency room workers, they're out of protective gear. So some of them are working 12 hours at a time without taking their protective gear off. Think about the biological ramifications of that. And that's because they don't have new gear to climb into. And so they're literally in conditions that are very difficult to imagine and to work through. They're tired, they're soiling themselves, they're fighting over scarce resources for this protective gear. You're seeing hoarding and all the other things that human beings tend to do in these situations. So for the U.S. to come in not only with experts, but with money and with protective gear, and to do it not only directly from the government, but to allow them maybe the face-saving option of receiving it from faith-based groups and from private industry, which we're doing, they're all kind of olive branches to the Chinese. And by the way, we've maintained that through the revelation yesterday that they hacked Equifax, and so there's all these things that we have to compartmentalize in our relationship with the Chinese. But I think, fortunately, for an after-action analysis later, but I'll throw it out there for somebody that wants to write a paper on this, the fact that we were in a kind of détente period in this trade dispute, I think, has helped us here. If we were still in the middle of a tariff dispute without any end in sight to what this administration is calling phase one, it would have further complicated the public trust and the international trust. So far, I smile when I say this because he couldn't have foreseen it when he said it, but I do believe that the relationship between President Xi and President Trump will help us here.
Interesting, very interesting. Is there a tension in China? I mean, going back to sort of the scene, is there a tension in China based on their political system of getting people back to work so that the economy can get restarted at some point? I mean, it strikes me that the longer the economy stalls, the more fragile the regime is, and the more vulnerable Xi Jinping is. But if you get people back to work too soon and you haven't yet contained the virus, then you're going to have another wave, or you're going to continue the spread of the virus. So is there a tension there? And I was thinking that this morning as I'm reading people going back to work, some people going back to work in some cities, and the stock market starting again. So what's your thought on that tension?
There's an absolute tension there, and I believe it's why public trust inside China is starting to shake a little with the ruling party, because they believe that the leadership in the country is staying arm's length and reporting the rosiest possible scenario, that it's a low fatality rate, that it's a little bit more like a seasonal influenza. I can't tell you that for sure. I don't know. I'm not in the minds and provinces of all these places and cities. I don't know how all the information is being received across China, but so far, most of the anecdotal reporting seems to suggest that there is a tension, and that the Chinese are erring on the side of repairing or restoring their economy, as opposed to, at least by perception, saving lives and reducing suffering. And in fact, I was surprised to read that we're hearing and seeing stories of Chinese workers self-selecting, refusing to go into work on their own. And that's, I don't know if that's atypical. In the United States, certainly it wouldn't be. In the United States, I joked the other day that some subset of people will say, I have to take 14 days off of work. I'm sorry, I'm going to self-quarantine myself. But we'll end up with a different cultural reaction than they have. And I guess one last thought here. It always baffled me, didn't surprise me. I was always surprised at the bafflement, I think was a line in a story that was written recently. Why American business leaders and Western business leaders that invest in China are surprised when there's instability, when there's forced technology transfer, when there's cyber-enabled theft of intellectual property, all the things that underpin the trade dispute that we've seen play out over the last 3 years. But this one was always the predictable number one on top of my list. Why would you subject your supply chains to the potential of continual health outbreaks and food security issues and food shortages? There was a pork shortage last year that was underreported because it didn't threaten American lives, but it was significant. And so I think the answer here, Barry, is that the tension exists, but they have way too much entanglement. Somebody tell me if I'm right. When SARS broke out, the Chinese economy represented sub 5% of the world's GDP. Today, the Chinese economy represents over 16%. And so this is an international problem of significance. And so the pressures aren't just internal, they're external, and they're afraid they're going to lose supply chain investors for the long haul.
Yeah. Let me hit on that a little bit, and then we'll turn to the audience. But I mean, we do want to address the geopolitical questions, and we don't want to seem callous or or overly harsh here. But we do want to think about those dispassionately. And we touched on the economic consequences in the near term. Those will accumulate as this keeps going on. I'm seeing reporting of major conferences of big companies pulling out of the Mobile World Conference, for example, Sony. Yep. Pulling out of that conference, a big defense conference in Singapore. Yep. A lot of big U.S. companies pulling out of that conference, so deals are not being made. Yeah. And on top of that, I mean, you quoted some numbers regarding Chinese growth, but I think the Chinese reported growth numbers are never actually the real numbers. Right. And the experts that I talked to, if it was 6% was the reported number last year, it's more like 4.5 or 5 or even lower. And so you could be seeing significant parts of the Chinese economy going into recession within the space of a few weeks here. I think if you're talking about the real numbers, and that has enormous knock-on effects on countries like Australia, like Thailand, other countries, and there's a lot of them that are intertwined with the Chinese economy. So there's near-term effects I'd love to hear any additional thoughts on, but then there's also longer-term effects. You were talking about diversification. I heard the term yesterday, ABC, anyone but China. Yeah. And so I think that's a little extreme, but what might be the sort of medium-term geopolitical and geoeconomic consequences?
Well, I really don't want to seem like an opportunist on this. Right. And for those who know me, you'll know that I have been advocating this before the outbreak of this disease, and that is, I would hope, I would like to see, and I've encouraged this U.S. administration to pursue something like the TPP, but through individual bilateral trade agreements instead of one multilateral one that had some of the maladies that attended to the TPP. I know that's politically controversial. I don't, again, pretend to be the world's expert on trade, but you and I have traveled to the region with the Atlantic Council, and I have held this view for some time that if we had the capacity in the U.S. Trade Representative's office, individual bilateral trade arrangements with Pacific nations, I think would be beneficial to them and to us. And I think now this anyone but China mentality would add to our leverage in those negotiations. Mm-hmm. But I wouldn't want to start any of that conversation until this was passed, until human lives were attended to, and you've caveated that. So let's think about how that worst case scenario I played out earlier would manifest into the economy short term, and then I'll take questions. If 16.3% of the world's GDP is tied to Chinese economic output, and half of the Chinese economy for 6 months or so is shut down, I don't know what the temporary nature of that ramification will be. It won't be permanent, but I would imagine it would throw us into temporary recession, not just the end of the cycle. So earlier I suggested it might just end our boom cycle, but I think worst case scenario with all the epidemiological models that I've seen would result in a really bad worst case, potentially short-term recession globally. Too many ifs at this point to predict that.
Mm-hmm. Great, thank you. Now's a good time to throw it out to any questions from the audience. So if you have any, let me know. Yes, over here, and please identify yourself, wait for the microphone, and please make it a question and not a statement.
Of course. Andrea Shalal with Reuters.
Thank you.
I wanted to ask you, Tom, about the kind of central beginning message that you had about trust. And given the climate that we're in now in the relationship between the U.S. administration and the news media, what happens with that question of trust when the organs that are transmitting that information are constantly being described as fake news, and their ability to portray the truth is called in question, and we live in a very bipolar, or sort of polarized media landscape. So that's my question.
Yeah, no, fair question. All I can do is tell you what I tell everyone that I interact with, students, media, presidents. There are a few rules that I live by in crisis management, crisis communications, and they're pretty simple. Tell the truth, tell people what you know, but also tell them what you don't know. It's just as important for the lie and the lie of commission omission type of analysis. But Tell people the truth, tell them what you know, and tell them what you don't know, just as importantly. And then, as I said earlier, forecast the future to the best of your ability. And I think people will respect that. And I guess the last one is this, and so far I'm going to give good grades, very good grades to this administration on this following category. If I didn't say it enough, I'll say it again. People don't care what you have to say. People don't care what you know until they know that you care. And I think that the early and consistent reaction, the decisiveness, in fact, the lack of discoordination. I think this has been a very coordinated effort, and I think even those that have been looking for fissures and fault lines in this administration haven't found any. Has impressed me and impressed the rest of the world. And so they're showing competence on a high level. They're showing or demonstrating that they care about the loss of human life, not just in the United States, but around the globe. It's a notable investment and mobilization of money and resources. It does provide an opportunity to improve our relations with China. But then lastly, I think that the medium might be an issue, right? You talk about, but the deliverer, the messenger is extremely important. And I am fairly proud of the fact that I was involved in helping to coordinate our biodefense and biopreparedness strategy for this nation and the implementation plan that was attendant to it. And this administration is following both. Now, they called it a task force, we called it a committee and the strategy, but they're following it right to the T. It's a blueprint that this president signed, and now he's asking his cabinet to follow. And there were a lot of internal fights over the years under multiple presidents, between interagency players with their various authorities, capabilities, and leadership instincts. And so right now, I'm giving high marks to Alex Azar, the Secretary of Health and Human Services. I'm giving high marks to all the other cabinet members that are on that task force for being supporting command and not getting into an issue over who's in charge with this thing. And so far, their public messaging has been honest, truthful. They've told you what they know, and they've told you what they don't know. I want to give Dr. Redfield, Tony Fauci, Alex Azar, Dr. Kadlik, Bob Kadlik, all of them high marks. Ken Rapuano at DOD. There is Steve Began. There is a cadre of people managing this that have excellent reputations, appropriate experience levels, solid credentials when it comes to communicating with the public, and they've all been empowered by the president. And he's made decisions without any hesitation on this. So I'll tell you, for all the political kind of angst that surrounds this presidency, in my experience working for him, he was great in a crisis for two reasons. He was perfectly comfortable making hard decisions, and he was exceedingly comfortable delegating to others responsibility. He was comfortable delegating to me the responsibility to coordinate disasters when I was still working for him. And I think he seems perfectly comfortable doing the same to this task force and to Secretary Azar. So for now, I don't think there's anything there to see in terms of criticism. We'll do the after-action analysis of everything. As we move into the domestic space and there's shortages and there's political disinformation, the next topic here, we'll have to revisit that question, because then the medium becomes as important as the messenger.
That's right. Other questions? Yes, in the back.
Hi, I'm Brad Hazen. I'm an intern here at the council. Something that I was interested to see shortly after the coronavirus news broke was North Korea closing its borders as a preemptive measure. Given North Korea's relative lack of state capacity and isolation from the rest of the world, what do you think? How would you evaluate the probability of the virus spreading to North Korea, and also the geopolitical implications if it does?
Since I just said to tell people what I don't know, let me just say I don't know. On your first question, the science of it, would be impossible for me to predict. I can tell you from my experience in Barry and I's geopolitical lives, it's hard for me to believe that there aren't still, a lot of border crossings there. And so if they're crossing into areas where they have an opportunity to come into contact with someone with this disease, I think it will transmit into North Korea, but I just don't know the geography there and the science of it. But I would not be surprised to see that transmission. Now, the implications would be devastating, right? There's already enough geopolitical kind of will to impose or enforce those sanctions on North Korea that we're close to starving them. We've pushed them into a malnutrition on a mass scale. So I think the implication would require China to kind of violate those sanctions on a humanitarian grounds.
Thanks, Tom. Yes, a question over here.
I also wanted to talk about how the policies you're talking about extend into food systems. I mean, most of the viruses up on this chart are zoonotic in nature, especially the more lethal ones. I mean, bird flu, a minor exception there. And it's definitely missing Nipah and a couple others that also affected food systems as well. And I mean, we could get into bovine spongiform and H5N1 obviously, but anything you want to comment on there that you know, we're talking about the economic implications of coronavirus, but of Wuhan virus, but frankly, they're much more scary scenarios, right, of viruses that could potentially affect people as well as food systems. Just wondering if the strategy's changed there.
Yeah, the plague is terrifying. If you try to put this into scope, well said. The problem is the uncertainty in that box, right? So if the prevalence ends up being 5%, maybe you think that's low. But if the R0 value ends up being 2.5 or 3, meaning for every one person they infect 2.5 or 3 people, and this incubation and asymptomatic transmission, dynamic continues to play out, it'll be a game of numbers, right? So you'll have a lot of suffering, and you might still only have a 1 or 2% fatality rate, but you might end up infecting, millions and millions of people. So I think the bottom line is, you don't want to terrify people into thinking if they get this, they will die. But you do have to do an analysis of the overall fatality rate so that you can prepare adequately.
Yes, one last question.
In other words, I would prioritize this. If the president hasn't already, he's made a very achievable goal of eradicating HIV. And I'm sure some of the companies that are working on vaccines for the Wuhan coronavirus might have to make a choice in terms of short-term prioritization. I would prioritize this novel coronavirus and come back to the longer-term objectives later.
Yana Slesrachuk, 1+1 Media Ukraine. So we now have Ukrainians and you have Americans who are being evacuated from China. And the next step, what is going on with them, they are put into some kind of quarantine. And then we have all this media which are constantly telling people about coronavirus, and like people are scared. And I wonder, how do you think we can tell people they do not need to panic on their fellow people who are coming back and who are being put into quarantine? I mean, how can we contain not the virus but the panic and all the consequences from this?
Yeah, no, great.
Back
So
to trust, and then with perfect segue to our next panel, but
that's
please
exactly
answer.
right. I think the segue to the disinformation panel is perfect. Well, the factual answer to your first question is today. The first plane of Americans brought from China back here, I think there were 195 of them issued on that authority I talked about that emanates from our Constitution. 195 of them were issued mandatory quarantine orders. And unless they demonstrate symptoms, today's their last day. I think they all get out of jail today, so to speak. So it's a 14-day wait. The word quarantine, I think, comes from 40-day wait on ships. This one's 14. On the panic question, I'll let the next panel address that. There's some obvious, there's some obvious transition period here from seeing people that appear or look to be Asian, right? And then abusing that and starting to pick on Asian people as if they're somehow the only carrier of this disease. That's, of course, insane. So we've now seen it infect any race. This is not a passport-specific disease. I think someone said, but I think there was a period of time there in the beginning few weeks where people weren't being racist or hateful to think that the disease came out of Asia. If you're Asian and you're from Asia, you might have a higher risk of having the disease. But we have to kill that pretty quickly in terms of a misinformation campaign. I don't know how much more I'd say on that. I haven't seen too much hate yet, but fear will come next. And I think we can combat that by being honest brokers.
And it all comes back to trust, as you mentioned earlier, Tom. Well, thanks very much for
Thank you.
joining us on short notice, and stay tuned. We might need you back, but we hope this thing gets contained and we can
Hope you're right.
move on to normal business. Thanks very much.
Thank you.
All right. Thank you. The next conversation is a good seg from that last question. And thank you for joining us for this second conversation. It's entitled Contagious Narratives, Global Responses. My name's Graham Brookie. I'm the director and managing editor of the Digital Forensic Research Lab here at the Atlantic Council. It's a center that's designed and set up to identify, expose, and explain disinformation with an emphasis on explaining disinformation. But we're also set up more broadly to kind of monitor the global information environment and a global competition for information. I'm joined by Ned Price here on the end, who currently serves as the Director of Policy Communications at National Security Action. Before that, Ned served as the Special Assistant to the President and Senior Director for the Comms Department at the National Security Council, the spokesperson at the National Security Council. I'm also joined by Rebecca Gustafson, who currently serves as Senior Director of Global Media Relations at Project Hope, which is an international nonprofit designed to empower healthcare workers around the world. And has also served in government in a number of roles, including on quite a few DART teams, which, if you're wondering what a DART team is, it's a disaster assistance response team, because in government we have to have acronyms for everything. First and foremost, I'd be remiss as the director of the DFR Lab if I didn't say follow this conversation online on the live stream. We're using hashtag ACChina and, unfortunately, coronavirus. As moderator, I have a prerogative as well as a responsibility as the director of the DFR Lab to set a few ground rules for terms for this conversation. First and foremost, every single day at the DFR Lab, we take the term fake news and we bundle it up and we rip it apart and throw it out the window. It turns out it's not a particularly good research term. In this case, it's not a particularly good medical term. So for the purposes of this conversation, we'll use the terms misinformation, which we define as the spread of false information without intent, which is important, and then disinformation, the spread of false news with intent. In the previous panel, Tom Bossert talked a lot about public trust and how important and critically important it is in the face of a pandemic threat. And so we're going to ask a few framing questions and then get into an audience Q&A. But first to Rebecca, what are we seeing on the ground right now? So you work with a number of folks that are on the ground, a number of healthcare workers that are on the ground. What are we seeing in terms of the information environment there? And then how does the information environment in China kind of inform or heighten the health risk globally?
Yeah, Project Hope has worked inside China for about 35 years and in Wuhan for about 20 years. So we have teams on the ground in several locations, including in Wuhan. The biggest challenge, I think, that we found is the lack of information and the lack of reliable information. When we first started asking about what is actually happening and what we need to do to help support the system, the health system and healthcare workers on the front lines, it was very difficult to actually get reliable information about the actual needs. And this is a result of a long-standing grip that the Chinese government has on sharing information, not only amongst its people, but also externally. And that challenge is being faced head-on during this crisis.
In the last panel, Tom touched on, as importantly as what we do know, what we don't know is critical in the face of a spreading information, viral information. So what do we not know right now?
Many things. We don't know the incubation period. We don't know how it actually started. There's a lot of rumors and innuendo about it starting at a wet market. Perhaps it was a pangolin, perhaps it was a snake, perhaps it was a bat. We don't know how many people are actually affected inside Wuhan. I think we're getting good information, but not great information relative to what we have been getting over the years from the government of China. The good news is, though, that the frontline health workers, every frontline health worker that our team talks to is dedicated to making sure that they do everything that they can to stop the outbreak.
Without going into the BuzzFeed listicle of all of the conspiracy theories that are, which they do a great job, by the way, if the audience has not looked at BuzzFeed's work on debunking all of the kind of random narratives or conspiracy narratives, without going through that entire list, and separate and unrelated from, or perhaps related from, the government of China itself, are there any prevailing narratives that are just outright false that you're seeing at scale?
One of the biggest ones I think that we're seeing is that you can't get any other care at any location in Wuhan other than if you have coronavirus. It's our understanding there are doctors, there are pharmacies that are doing their best to help. The catch is there are so many people who are either symptomatic or fear that they are testing positive in the near future because of contact that they've had with others who have been tested positive. And so I think that is the real fear right now that we're seeing, is that people are afraid to go to the hospital because what about coronavirus? But also sometimes they're presenting with other symptoms. The other day we were hearing from a neurology department of a hospital in Wuhan that reported that people are coming in with various symptoms. You know, it's not like they're coming in and saying, I have a pneumonia-like virus, please help. They're coming in and having seizures, or they're coming in and having headaches, and eventually, once they go through the triage process and actually get tested, it turns out that they do have coronavirus. So people aren't just coming into the ER where doctors are wearing PPE, if in fact they have PPE in their hospital, and being able to say, okay, you have coronavirus, come over here to the isolation area. So people are coming in through various channels into hospitals.
On the flip side of that, what's the misinformation risk, or the kind of stress on the system risk of people coming in, not just in Wuhan, but in China more broadly, as well as around the world, if there's a little bit of a sore throat or it's flu season and you have a little bit of a cough and saying, I definitely have coronavirus and I need all of the resources to deal with that.
Yeah. Well, it's the same thing that we see here in the United States when that happens, only magnified by the number of people in China who could possibly have come in contact with somebody who has coronavirus. So the danger is putting stress on an already extremely, extremely stressed system. I think we're looking at numbers right now of doctors who've had a protective suit that they've used all week, 1 week long, which is kind of terrifying. They've used UV light to try to disinfect at the end of the night. Now, I haven't seen that as an option in the WHO literature. The good news is we have been able to bring in additional PPE, but that's to treat people who are actually confirmed having coronavirus. You overlay the number of people on the top of that who are nervous that they might have coronavirus, who have a mild sore throat, who end up not testing positive, and they're stressing that system further. And that's one more set of PPE that needs to be used that is already being depleted in the system.
Right. So misinformation has a potential to reallocate very, very limited resources in the face of a crisis.
And it's not just the physical supplies, it's also in the time of the health staff. Health staff are working around the clock to make sure that they're treating the people who need treatment, testing those who need tests. And if you have people walking in who haven't come into contact with someone with coronavirus, don't necessarily display the symptoms, and are sort of in need of additional triage and treatment, it does stress the system further.
Ned, I'm going to throw you back into your old role. What is the role of a single government or multiple governments or multilateral organizations in communicating to citizens when a pandemic threat doesn't respect our neatly defined borders. It could be kind of everywhere. There's a lot of kind of insinuation or innuendo about the pandemic threat. What's the first thing? Could you walk us through what the first thing that you would do if you were a spokesperson right now trying to allay public concerns, but also inform them of a very real threat?
Yeah, it's interesting that you refer to my old role, and obviously I don't come at this as an epidemiologist or a development expert by any means, but a lot of the lens through which I view the current response to coronavirus and epidemics more broadly is through the 2014-2015 Ebola outbreak, which actually the three of us all worked on together. I would be remiss without saying that, Graham, you and I were right across from each other at the National Security Council staff for a couple years. We worked ISIS, Iran deal, any number of foreign policy developments. But I don't think there was a period of more sleeplessness and frenetic activity on the NSC than that period between late July and November of 2014. And we can talk about the reasons for that, but I suspect that the current administration is enduring some of the same of what we did during that time. I think it's important to remember when it comes to an epidemic like this, an epidemic that doesn't respect borders, that has no sense of nationality, that there needs to be an effort to divide and conquer on the part of different countries, international organizations, in terms of the various audiences to whom you need to communicate. I think that is actually the first task, is determining what those specific audiences are. And so let me use the Ebola example to illustrate that. So in 2014, there were any number of constituencies that had to be in receipt of accurate, timely, credible, science-based information. Of course, first and foremost, it was the population in the affected area in West Africa. You take a step back, and it's the populations in those three countries in West Africa, even those who weren't necessarily in the exposure zone. Healthcare workers and first responders who were there on the part of international organizations and who later were sent there by Western countries. Healthcare workers around the world who may have been at heightened risk of contact with someone who is exposed to the disease. Immigration and customs workers became particularly important as the disease did have some limited spread outside of West Africa. And then, of course, the domestic audiences. Rebecca and her teams were quite focused on the international piece of this, but at the National Security Council at the White House, we were particularly focused, especially in October, November of 2014, on that domestic audience, because the level of fear, the level of paranoia really did outpace the risk that average Americans faced. And so we had audiences in Dallas as the first case was diagnosed there. Later in New York, where we had another Ebola patient who was being treated, audiences around those centers of excellence that treated Ebola patients who were medically transported back to the United States. And so it's determining both that list and litany of audiences, and then determining who has that comparative advantage for communicating to each audience. Of course, the United States government isn't going to be the most effective communicator when it comes to conveying the message to Liberians in the outbreak zone that germs and not witchcraft are the cause of transmission. But the United States is always going to have an outsized role because our policies and our communications often in turn redound on countries around the world. So when we institute and when we speak about screening and active monitoring of those arriving in the United States, that rationale, those communications are often picked up by some of our closest friends, some of our closest allies, who then institute similar policies and speak about it in similar ways. And so I think overall it is a tremendous coordination effort to make sure that the various countries, the various international organizations, that they are speaking to the right audiences, that they are directing those messages at the right audiences, and perhaps most importantly, that there is consistency across across those messages. Nothing can undercut this sense that something is under control, or at least can be under control, than when various audiences hear inconsistencies and even different messages.
One of my jobs is to verify information, and I can absolutely verify that one of the moments in the litany of crises that you mentioned, from Ebola to the fight against ISIS and a number of other things, it was absolutely, Ebola was one of the things where we had the most uncertainty, or there were the most unknowns about what we needed to do and where we had resources, and frankly what the facts were.
It was interesting because there was tremendous familiarity with Ebola in some sense. It was the stuff of Hollywood, and people thought that they knew the disease from movies like Outbreak and books that were highly fictionalized. And so I think that was a challenge, that there was tremendous scientific uncertainty about elements of it, but the public perhaps was overconfident in its familiarity of what it viewed as this horrific disease that in their mind spelled an almost certain and certainly gruesome death. I think coronavirus in this case, obviously, there's a lot more uncertainty. I think, prior to late December, very few people had actually been familiar with it. Certainly this strand of coronavirus. And so the educational effort, the educational task is different, but the requirements there are no less staggering.
So a question for both of you. We're talking about trusted communicators and kind of how to navigate the information space around coronavirus right now. Who is the most trusted communicator on it? And for all of the audiences that would be relevant, whether that's a hyper-local audience of the population in Wuhan or in China more broadly, and then internationally, if you're in Wuhan right now, who do you look to for information on this?
Your friends and neighbors. Let's be honest about how this works. And I think that works. It works that way in any country, regardless of how information is officially shared. I think if you hear from your mom or your dad or your brother or your sister, your aunt, your uncle, it always makes a bigger impact, which is, on the flip side, a lot of times how this misinformation is being spread. Mm-hmm. You see somebody who tweets it and you say, oh, I know them, they must know, and you sort of continue to push that information out unwittingly. And that's happening locally on WeChat, as well as the other services that are used inside China. That information is being shared as much as possible. Some of the messages, as we've read in the media, have been deleted or have been blocked. And it's a very dangerous thing in the middle of an outbreak to sort of have limited information that's being shared amongst the community, because someone will step in and fill that gap. And a lot of times that information won't necessarily be the accurate, reliable, trustworthy information that should be there and should be provided to people.
Well, and for a group like ours, understanding Twitter is particularly easy. It's measurable, it's open. We can kind of go in and see what the spread of narratives looks like. On a platform like WeChat, it gets a lot harder. So, noted on trusted information environments, internationally, what does that look like?
So I think one of the great ironies here, and it's something that has struck me over the past few days, is the Chinese government seems to be doing a more effective and concerted job at communicating to international audiences with fact-based, science-based information than it seems that they are, or at least have been, when it comes to the domestic response. So on Sunday, the Chinese ambassador to the United States was actually on a Sunday show. Ambassador Sui went on CBS to reiterate the messages, and also to push back at some of the information they perceive to be misinformation. The idea that this originated with a Chinese biological weapons program that was actually repeated by a sitting U.S. senator. Across the country, Chinese consul generals are doing public speaking events in at least what seems like a pace that is highly uncharacteristic of a government that often doesn't go out there around the world. Especially in the midst of crises, when I think the default is to sort of hunker down to weather it, and then to sort of give an after-action report. That doesn't seem to be the case. I don't think, at least from what we've seen so far, that the same could be said for the level of communication that we're hearing that the Chinese government is delivering within China itself. And I think the level of transparency, the speed of information has been a tremendous impairment to efforts to combat the disease. The mayor of Wuhan was actually quite frank in offering comments recently and saying that had he known at the time, he would have instituted some measures much more quickly. And I think it was some 5 million people who had left the city before the quarantine was instituted. And so I think when all is said and done, and hopefully sooner rather than later, with this current outbreak, I think we will see that communication and effective communication will have been just as important as some of the measures that we've more recently seen instituted by the Chinese government.
To touch on one of the themes from the last panel, there is a global competition for information, right? And noting those audiences, the explicit difference between communicating to domestic audiences as well as communicating and frankly competing within an international audience is entirely critical. One of the things that we saw, just as a side note from the DFR lab, was a number of conspiracy theories in Russian state media about how the virus was created in a U.S. lab in Georgia, which, for those of you that have been keeping score at home on Russian conspiracy theories, that's a recycled one from a few past viral instances or pandemic threats. So what's your assessment of why there is that kind of bifurcation of audience, right? Like, what are the priorities in terms of communicating to the domestic audience and communicating to the international audience? One of the things that we see pretty consistently is that communicating in systems that are less open, communicating to a domestic audience is about retaining power, but not necessarily creating a culture of transparency or accountability. What's your assessment on coronavirus with that angle in mind, essentially?
Sure. So I think, again, going back to 2014 and 2015, I think probably the closest analogy we've had, certainly in recent years. The communications to that affected region were about education. It was about educating potential to educating those within the outbreak zone, the means of transmission. I think in this case, in the case of China, which is a very different governmental system than what we saw in West Africa, there was and there is a degree of power politics that are at play, to a degree that certainly was not in West Africa, where the response was much more based on the science, much more based on the facts. I think what we need to see here, and I am not sure that we have seen it to the degree we should going forward, is a similar response to what the previous administration did vis-a-vis public communications. That's not to say that it was flawless. It certainly wasn't. I think early on in the certainly in the public concern in this country, we heard from public health officials who were perhaps overconfident in what they were saying about the ability of American hospitals, the American health system to safely treat Ebola patients. I certainly remember the promise, or at least a statement, that every American hospital could safely treat an Ebola patient. And I think Dallas certainly proved initially that there needed to be some more nuance and caveats there. So I think what we need to see here is an emphasis on fact-based information, but reliable fact-based information. And I think the key will need to be to ensure that people have the proper context and the proper perspective so that they can take prudent precautions for those that who may be at elevated risk, but still without engendering the sense of national paranoia and even crisis that I think was pervasive here in September, October, November of 2014.
And we're starting to see small glimmers of that with the coronavirus response. I don't know how many of you have tried to go to a CVS or a hardware store and tried to purchase an N95 mask, but they're not very prevalent in the United States anymore. And that's actually impacted sort of the global health community across the board, worldwide, whether it's the Ebola response that's currently ongoing in the Democratic Republic of Congo, or when we're talking about doctors and hospitals here in the US that need to stockpile personal protective equipment, or the doctors and nurses on the front lines in Wuhan. And it's a huge challenge that the global health community is looking at right now to try to figure out how to rebalance that. The supplies are not there that are needed in order to maintain the current stockpiles that are in China, much less to ramp up to meet the needs that we're facing now. And just looking across the board, it seems that about 100% increase of needs when it comes to personal protective equipment since the coronavirus outbreak started, and the prices have gone up about 20 times, which is a little terrifying when you start thinking about we need more and the costs are going up. And when we talk to doctors in hospitals in Wuhan, the first thing they say is, we think we have the funds, we just can't get it. And so that's one of the things that the international community has been working to try to do is to expedite the supplies in. But that's something that here on our end of things, outside of China, we can also help promote.
And information is driving that market.
Yep.
Or incorrect information, is slightly inaccurate or incomplete information here, which is to say, unless you are cleaning asbestos out from your roof this weekend,
Right.
Don't go buy masks at CVS down the street in Washington, D.C. today. To steal a conceit from the last panel, how would you grade China's communications on this topic? And how would you grade the United States government's, which is a main communicator on these on an international stage?
Well, I'll start with the domestic response. I think every grade, both for the Chinese, for international governments, and for our own government, has to be incomplete at this point because this is very much ongoing. I might differ slightly with what we heard from Tom Bossert. I think we have to distinguish between the operational response and the operational level, and then perhaps for lack of a better word, the political response and what we're hearing from some of our elected officials. I think operationally, the men and women of CDC and HHS, USAID and state are, and then their domestic counterparts are doing, of course, not surprisingly, a fantastic job in the response and assisting that response in China and around the world. What concerns me, however, is what we've heard from the much higher levels of the U.S. government. And I think what strikes me are statements from the president that this will be over by April as temperatures warm up. I think that certainly flies in the face of epidemiology, or at least it is not, there's certainly no basis in fact that is a reliable fact, at least, to suggest that that's the case. His statements about President Xi acting transparently, saying in interviews and over Twitter that President Xi has it fully under control, China has it fully under control. I think some of that may be a reflection of the bilateral relationship rather than the epidemiology and the course of the coronavirus itself. I think that as we have seen in other sectors with human rights and other areas of bilateral concern, trade and the economic aspects of the relationship tends to overtake everything else. And my concern is that we're seeing some of that reflect in what we're hearing from President Trump in his characterizations. And I think we have to remember that 90% of the response is going to be operational. But there is a very important element at the tip of that iceberg that involves the bully pulpit of the American presidency. And to revert to Ebola one last time, I think many of us remember President Obama inviting Nita Pham, one of the nurses in Dallas who was infected with Ebola, to the Oval Office and hugging her. And it wasn't anything that was said. It was just the message that sent and the imagery of the President of the United States communicating, silently in this case, but communicating a very fact-based approach, knowing that she wasn't symptomatic, knowing that the risk was nil, and demonstrating that for the American people. I think there were other examples of consistent White House briefings involving not only Lisa Monaco, for whom you worked, Graham, but also General Rodriguez, HHS officials, CDC officials, bringing them and having them stand side by side and reflecting that sense of cooperation, of unanimity of effort to the American people that I think we need to see more of, in tandem with statements from the president and his most senior advisors that are based in fact rather than the broader geopolitics.
Anything to add?
You know, the way that we look at it from our teams on the ground in China is the politics isn't what matters to us, right, as a humanitarian organization. It's getting assistance directly to the people in need. And I think we felt that way, obviously, in Ebola response, whether it was in West Africa or in the Democratic Republic of Congo, and that is what is happening here right now. I think the biggest challenge that we do face is, as an American-based organization, is getting our assistance in, and that is one of the reasons why we are always a little bit holding our breath and making sure that our long-standing relationships will continue to help that to happen. I think the one thing on the humanitarian side of things that we're always very nervous about is at any moment something could change and the spigot could get turned off and additional supplies can't get in. Additional quarantines could happen in locations where we don't have staff. So it's continuing to make sure that we have those relationships and continue to build those relationships even in this time of crisis to make sure that we can get those supplies in where it's needed most.
Understood. We're going to turn to the audience for questions now, which we have about we have about space for 3 questions, if there are any, and if not, I have plenty. Yes?
I'm Andrea Shalal. I want to repose the question that I asked before, which has to do with the sort of erosion of trust in the media, and also the kind of obviously very bifurcated nature of how the American public views the administration. Given the need to communicate carefully and you know, how do you see that playing out both here, but this is also a global question. You know, the trust in these institutions is significantly eroded. And so when you're faced with something like a pandemic, how do you rebuild that in the space of time that you need to get people to comply?
So I say this only somewhat flippantly, but the answer to every communication challenge in the Ebola context was Anthony Fauci. You know, the point being that there are recognized experts who I think transcend politics, who transcend the polarization that we're seeing. These are individuals who've worked across administrations, who, as far as I know, don't have a political bone in their body, but know as much as anyone, and in many cases quite a bit more, about the threat of epidemics. And so, of course, Anthony Fauci is not the only one, but I think he is illustrative of the type of people who are most useful in this case. These are individuals from CDC and HHS, from AID, from the DART teams, who can speak with authority, and who I think can communicate in a way that eschews all of the sort of partisan polarization that we've seen. And I think the first rule of thumb is that facts have to guide the response, but facts also have to guide the communications. And when you have individuals who have backgrounds, professional backgrounds in this, who are invoking facts and speaking facts and conveying that in a way that acknowledges both what we do know and what we don't know, I think is important. I think that is the way to most effectively combat that challenge.
And I think that last part is huge. It's not just what we know, it's also what we don't know, which continues the cycle of trust and builds it over time. It's not something that we can start today. It's not something we can start tomorrow. It's something we need to start yesterday so that we have that trust when it does happen.
Next question? Yes? They'll run you a microphone.
Thank you. to me, the same trust apply to the international organization, like the World Health Organization, right? So a lot of people thought that the emergency was called too late when we saw such an extreme measure that they, were taken in China. And also we knew there was a lot of pressure from China because they didn't want that emergency to be called. So how we can trust organization when we know all these lobbies doing, a big impact, having a lot of impact?
I think one of the biggest challenges is in any outbreak or health crisis that is of global impact is having layers that are involved, right? So you've got the World Health Organization, who deals not only with the health issues, but also on the diplomacy side of things, which makes it a challenge when we look at it from the outside, because the World Health Organization not only has to help negotiate releasing that information to the public, not just in China, but in other countries who have outbreaks, and making sure that happens in a timely fashion, in a way the local government is comfortable with, so that assistance can be provided. And that's all interconnected, and it's very, very difficult to disconnect that. I think we can all sort of Monday morning quarterback the World Health Organization and say, woulda, coulda, shoulda, wish we could have done it quicker, wish we could have done it faster. I think when we look back and we do an after action, I think we'll realize that China shared much more information this time around than they did in the SARS outbreak, which is a great thing and should be commended. Would we have liked to have it sooner? Yes. Would we have liked to have more information? Yes. Do we wish that the World Health Organization maybe had been triggered sooner? Sure. But at the end of the day, what we need to do is to make sure that assistance can get in, that information is being shared. And sometimes you have to make that negotiation happen in the time and space that it's needed. And I think that's always the challenge, looking at it from the outside.
Just to follow up with both of those questions, is there anything that media should be doing differently? And I understand that it's uncomfortable to kind of play media critic in this moment, but if we're looking at the spread of information and disinformation as a collective problem or challenge, the response is going to involve government, which is what we've been talking about mostly. Mm-hmm. It's going to involve media, specifically as the lens through which most people consume that information, and then social media, which goes back to trusted information environments with friends and family. Is there anything that media, which is the only kind of element of that triangle that we haven't talked about, should be doing differently?
I think what's most important in a case like this is context, and especially when there are known unknowns, to use the phrase. For example, I was listening to a report this morning about, and we were talking about this before the panel, concern about a particular apartment building, because it seems that residents of this apartment building have come down with the coronavirus despite a lack of contact between them. And so there's some speculation in media reporting that perhaps it is coming from the ventilation system, perhaps it's coming from the plumbing. We just don't know. And so, I think those types of reports have the potential to be very dangerous in the cause of undue alarm if they are not accompanied by that context. And I think oftentimes when it's a short 30-second soundbite, there tends not to be that context. I think the other element that fortunately we haven't seen yet, but we very much saw it 5 and 6 years ago, was the politicization of this. We're in an election year now, so I think there is the potential for this. But we all remember in 2014 and 2015 how so much of it was personalized and put in a political context, especially when it came to the measures the United States should institute to respond to this. And so you had the nation's top scientists and epidemiologists and health experts saying one thing, but that being countered with the claims from, in some cases, one individual that would be put on the same plane. And so I think we need to very carefully I think we need to make sure that we don't go down that path again. And I think, fortunately, there's been a good degree of consensus about how we need to take this on. But if that delta again emerges, we need to make sure that that isn't a path that is sensationalized in the way it was before.
But it's hard.
Yeah.
I mean, let's
But
be
there's
honest
Twitter,
about this.
right?
And as somebody who sort of follows this news all day long, whether it's getting information directly from our staff in the field or whether it's on social media, I have a hard time a lot of times being like, wait, is this true? And having to go and dig and find the information that I know many people, including my parents, wouldn't take the time to do, but would forward it on to somebody else. And so therein lies the challenge for all of us, is to make sure that not only are we helping support information flow to people in China, to the media, to the American public, but also making sure that we're supporting the ability to share it. And I think, not to jump back to WHO and thank them too much, but one of the things that I think they've done differently in this response that has been extremely helpful to us as a humanitarian organization is they've set up the Mythbusters section. And I don't know whether you guys have seen them, but they're actually pretty great. They're like, can I use UV light to disinfect my hands? And it's a great little infographic, easy to share. And sometimes that can sort of help put a pin in that thought that someone is spreading. Other times it's too far gone, and at that point,
At the very least, it creates a barrier cost.
Yeah. Correct.
Any other questions? We have time for one last question. We're going to go back here.
Hi. I have a question about trust. So how do you think, how trustworthy is the data and information provided by the Chinese government? And also another question about trust. We know that the Chinese government is a little bit more transparent and effective in communicating with the outside world, but inside we see it's kind of cracking down on some information on social media, especially WeChat, and especially in recent days. So, do you think its action inside China will actually have a counter effect on its communicating capability or ability with the outside world?
I would like to say yes, but I think we have to be honest about the government that we're dealing with. They are hands down sharing infinitely more information than they shared on SARS, but that's not hard. So I think when we look at it and say, how can we, as a humanitarian organization working in China, help foster the trustworthy information that's being shared, not only to doctors and nurses, but also to those individuals who are benefiting from those services at hospitals in Wuhan, at hospitals in Shanghai, at hospitals around the country. And we look at that and say to the government, to the local officials, how can we help support you? That is not sort of where we are yet. I think at this point, we're supporting with supplies and supporting the hospitals and the nurses that we've spent 20 years training in Wuhan. And for us, it's about much more than that. It's about much longer term training with infection prevention and control. It's educating people about how you can and can't get coronavirus. It's taking those Mythbusters and making sure that that information is getting out there so that people are sharing the right information as opposed to sharing only the information that they have at hand, which turns out not to necessarily be true. So it's a huge challenge.
We spent a lot of time talking about how trust is really the coin of the realm in a epidemic response like this. But there is nothing more difficult than regaining trust when something you have said, something you have done turns out to be not true, whether that was intentional or whether it was, in fact, an intentional effort. For those of you who haven't seen it, the DFR lab put out a really fantastic study on communications around coronavirus, and there was this idea that among some mainland Chinese, that coronavirus was a patriotic disease, because insofar as the Chinese government initially was portraying it, it was in Wuhan. but then it hadn't really spread elsewhere in mainland China and was going beyond China and was sort of avoiding Chinese citizens because of its patriotism. Of course, as more information came out, the Chinese have developed a greater appreciation for its spread. But I think the Chinese government is now playing catch up, and I think that is a function of its own doing. And I think that challenge is compounded when there is a low level of trust and a high level of distrust in the first place. It makes the challenge all the more difficult to regain that ground that you've lost. But in order for the response to be effective, I think the Chinese government will really have to go into overdrive to do just that.
For parting thoughts, the World Health Organization puts out their 10 top global health threats every single year. And this year, one of them was phrased vaccine skepticism, but they were a little more on the nose on the way that they communicated that in the speech. And they said, misinformation about health issues is one of the top global threats. Of course, they're referring to vaccines. In this context, it's the crisis is more immediate. Mm-hmm. And so how do we fix that going forward? How do we make misinformation not a top global health threat, according to WHO?
It's building the trust across the board. It's not only here at the national level, it's at the local level, the state level, and frankly, going all the way down to your community, to your school. It's finding those trusted partners that you trust today, that when something happens tomorrow, you know you can go to and they have the right information. And that's across the board, worldwide. And that's something that global health experts are working on. We have a long way to go, I think, in many countries. But it's supporting the health workers, but also supporting that information flow. Because if you don't have that information flow now, you're not going to have that information flow when something happens.
I think it's that idea that only light can counter darkness, only truth can counter misinformation and disinformation. I think in this case, that truth has to be fact-based, science-based information coming from recognized authorities from various governments, international institutions, but that at their core are consistent with one another and based in that science. I think that has to be the overarching message that both our communications, the collective we, our communications, and our policy response to something like coronavirus has to be guided not by politics, certainly not by fear, but by the epidemiology and what we know of the science of the disease.
Great. Thank you. And please welcome me in thanking Ned and Rebecca for joining us today, and thank you for joining us today.